Yves in the house. And I thank everyone for staying around. Here, let's give this to Yves. He actually doesn't need an introduction, because I think if you watched CBS Sunday Morning a couple weeks ago, you learned a lot about him. Or if you've ever looked at Wired magazine or even Air France magazine, it seems every time I get on a plane, I'm visiting with Yves. So he's had a very exciting career for as young as he is. He's in a lot of museums, and he's developed a lot of products that have made big impact around the world. You probably know of the one laptop per child computer that he designed and has been distributed to many, many children. And also the products, some of them the wearables that we're wearing right now, the Jawbone Up, the fun music that we get out of our Jambox. So he's had an impact on our lives in many ways, and in ways that you might not really know the source of the impact. And it's because of his unique abilities to profile individual users, I think, and pays great attention to that. So we're very fortunate to have him here today. And he's thrown me a little bit of a curveball, because we had initially talked about him doing a presentation for us, but I think he asked me to interview him. So this could be kind of fun, because really the last time I saw him was in Bolinas at a garden party, so I don't know what's going to come out of this. Yves, thank you for coming.
Thank you.
You want to do it?
Hi. How's everybody doing? It's me, you, and their weekends.
Exactly right. But there's supposed to be some beer and peanuts out there somewhere, or pretzels. Yves, thank you for coming. I feel very honored that you're here with us, and to have like Bill's expertise and your expertise and your deep creativity being turned with your passion now to help people in healthcare is very exciting for us.
Well, I think, for me, I'm a designer, and I love creating consumer experiences. And a lot of the things you have mentioned are things that people know and they experience in their lives. And the question for me has always been, there's this whole other, almost more important part of our lives, which is health and healthcare, and probably the central concern that people have. And yet there isn't a lot of design a lot of designers and a lot of design who gets to intervene in that area. It's somewhat similar to 10, 15 years ago, there was very little design in the developing world as well. And there were a couple of breakthroughs, there were a couple of moments of change, like one laptop per child and other projects like this, which really signified to people in nonprofits and governmental agencies that something could be done there. That design was efficient, that design was bringing results, that design was delivering services in a better way, and it became very clear that design could do something.
I think that's an interesting point. If you don't, since you asked me to interview, I'm going to interrupt once in a while, just like we're in the garden. But what I would like to say to that is it just points out that design isn't a luxury. And so when we talk about low or middle resource countries, which is a phrase now, we often think about not adding the luxury items, just something very utilitarian. But you've just pointed out, I think very clearly, and correct me if I'm wrong, that design isn't a luxury.
This is one of the, I think, old stories that you see played out a lot in the media, which always features design as something that is utterly expensive and luxurious and superfluous in a sense. I think of design much more as much more important than that. And I think that design can create efficiencies, create adoption, create delight, as Bill mentioned, at any price point. Whether it's a laptop that's given away for free, or a pair of eyeglasses that are given for free to children, or whether it's whether it's a hospital bed, or whether it's a portable healthcare health technology that somebody would have with them. And so I think we're coming out of that kind of cycle of people just thinking about design as a luxury. and going into the fact that delight doesn't need to be a luxury. But what I'm looking for is what is going to be that moment and that breakthrough that's going to wake up, I would say, the entire industry and thank you, and the world in a sense about what design can do that changes health and the experience of healthcare, the experience of that entire domain.
And how do you get that understanding of what, if you could very quickly, I mean, it sounds silly to say because some of it is just your genius, but so I'm sure there's not a formula, but how do you start your question of if you have a user that has a need, how do you start your questioning process of how you're going to start mapping a solution somehow?
Well, I think so many times we enter worlds and we enter areas where actually the need isn't even verbalized yet, right? When you enter these new categories and these new spaces, often it's sort of pent-up demand that people simply don't think is possible. They don't think industry can deliver that. I don't think they believe that healthcare can deliver a delightful experience. I am not sure there are many briefs in this world in health that have that at the top, as one of the top 3 ingredients. You want to deliver results, it's important. You want to deliver the right data and the right information, but where do you put delight? Where do you put the human experience in that? And I think that's what we look for. We look for what are those moments? What are the moments that people don't expect where we can deliver tremendous added value? So often, people don't know really don't know what you're going to be delivering is even possible. And I think this is when there's big breakthroughs. Behind me is the whole area of the quantified self. And 5-6 years ago, the quantified self was a few techies in Silicon Valley wearing all kinds of very strange gizmos, it wasn't millions of people interested in their everyday health and lifestyle and how they can improve things, and that turned on a dime. I mean, that is there's a competitor that went public yesterday, and there are large companies like Apple that are starting to tell a story around health and their devices. It's an incredible change if we think about what the quantified self was, just a few years ago.
Well, I think the approach that we've been learning about embracing design in healthcare in our innovation process is that we've been doing things backwards. We've been bringing a technology or a solution that was designed by the non-user and they weren't involved in the conversation. And let's take the EHR, you bring it to the front lines into the physicians, and then you expect them to change their workflow and their process and what's meaningful to them to fit the solution. And it seems like we're just learning to completely reverse that equation in healthcare, because it's the same way we've been delivering our solutions to patients, is to say, well, here's what you have and here's what you need to do for it. And I think it's been making a big difference for me to take some of the design thinking even into the way that I converse with patients now, rather than assuming I just need these data points. There's an open-ended way, I think I've been learning from my design colleagues, that you can source information from people. Maybe you could speak to that, because I liked earlier when you said we assume we know the need.
Well, and there are many fields like this, and certainly healthcare is one of them, and it's very process and step-by-step. It's a very process and step-by-step approach. And a very formulaic approach, and you try to improve one segment of it here or another one over there. You try to make things better at either ends, but you don't really, you rarely get a chance to look at it, through and through, and end to end. You know, one thing that that I always think about is, you know, my next visit to the doctor, I have 3 years of data. I have 3 years of data of health data, sleep data, physical movement data, and now I'm getting close to a year of resting heart rate data. You know, how are you going to find out what's going on in my life in a 5-minute discussion, doctor to patient? How about I send you something like this? It would look a little different, but how about I send you something that's a little bit more readable than that, and where you can see, you know, wow, you've been a lot more stressed in the last 6 months. I can see your resting heart rate, you know, has maybe changed, rather than me having to describe symptoms, which, you know, aren't always obvious even to me, of how I'm doing. So, you know, I'm thinking about even doing that almost as a joke, like bringing like a big pile of paper and say, you know, what do you think of this? But and we're really at the onset where it's 1.0 of what these devices are going to be doing for us, and you know, I can only imagine with all these other sensors coming on, respiration, heart rate, all these ways that we can know what's going on, and it doesn't have to be hyper precise because it becomes very meaningful over time, right? It doesn't matter whether it's 5 or 10%, you know, off, and I'm saying that a bit as a provocation because I know that's a lot of the conversation that's going on. It doesn't matter that it's hyper precise. What you're looking for is patterns. The ability to see patterns over long periods of time, I think, is fascinating.
I think that's
for me
true.
Individually.
It depends on the use. It depends on the indication. But I think that's absolutely true if you're doing serial measurements, and it depends on what you're doing them for. So I would agree with you on one piece of that. It depends on how it's used. And I think when we look at all the wearables, first of all, there's physiologic data that because of your designs, people are wearing these things more, and we're getting that data. I'm curious about how we can start bringing in more the subjective data or the less tangible data that actually makes up the whole human. What was going on for them? I mean, this might be your travel schedule up here, I'm not sure, but that would be quite stressful. But there are parts that we don't pick up with physiologic monitors that I would think would be of especially great interest to you, that describes the whole person.
So we have ways to you know, engage people with notions of mood and you know, how are they feeling, and the fact that I can see, that I can visualize that I can see it in my app, it helps me correlate different factors. Or I had a little bit too much coffee, or I had too much sugar, and that puts me in a good or a bad mood. Or, you know, this when I'm not feeling well psychologically, I eat more. These are all things that we know, right? I mean, we know you should, you know, take the steps and take the stairs and not the elevator. We know, you know, if you're in a you know, in a psychologically kind of you know, if you're in a bad mood, or if you feel down, you're going to be exercising less, and you're going to be you know, eating more, for example. We know these things. We know this, you know, through research. But when people see it for themselves, when they are able to look at this and say, look at these patterns. When I don't sleep well, I exercise less and I eat more. How, you know, you can start acting upon this kind of realization. So I think insights, learnings, sometimes you know, I think we've forgotten to trust people that these things are important, especially if they're done in a self-discovery manner rather than somebody telling you.
It goes back to the point of what we've tried to build into the hospital, of a person feeling that it's very much about them, but that they're actually influencing the environment. It's not just something being done to them. We're going to run out of time so fast, so I'd like to make sure that you get to tell us about some things that you're excited about, either that you've done already, and lessons you've learned about them in the design process, or what you're excited about that you're working on or that's
Sure.
coming up for you.
Sure. One of the things I'm excited about is what happens when you look at data in aggregate. So we've talked a lot about how when the data is personal, it is something that has special meaning. And self-discovery is sometimes just as important when it's when it's underlined with other studies and data. But data in aggregate is fascinating because we could be running pretty soon with all of these trackers the largest studies on sleep or food or other elements such as stress, for example. The other areas that I find fascinating, I'm going through a few slides, is the aging and how, just as much as we're not looking, as I was saying earlier, so much, as we weren't looking at design for the developing world, we're not looking at design specifically for aging in place, for aging in general and a sort of retirement. And there's a couple of brands, one of them is called Sabi behind me, who are trying to make products that just look amazing and are addressing things like calendaring of pills or reduced dexterity, etc. But without creating a stigma around it, without saying, oh, you must have arthritis, so use the products with the really big red knobs on top. If you saw this product in somebody's bag, you would say, wow, that's a very cool bottle. Where can I find it? The other area where we've had some interesting projects recently is what happens in the lab. Lab technicians are just as familiar with new technologies, iPads, interfaces, expressive design. So with Fluidigm, we created a new approach to their medical devices, specifically aimed at the lab technician and creating a bit more recognition and a sort of a flow of interaction, a flow of on-device interfaces that are more interactive, that are just more natural, in natural language, etc. Rather than something that looks like DOS. And a couple of the projects that I'll mention is what happens when we really take these ideas of wearables to the extremes. What happens when maybe each of these devices, this is for Time magazine, has a different functionality, and I can wear them and combine them in different ways on the body. When I feel like I don't want all the information, I'm just interested in this information for the next month or the next two. And then finally, the projects that I've mentioned, which are the One Laptop Per Child that you mentioned, the One Laptop Per Child, and this eyeglass program in Mexico. What happens when we can start to bring technology and design to places where it's not available yet? One of my big reveals was that I was visiting places, faraway places, which pretty much still lived in the age of bronze, but they had cell phones. So it's the age of bronze with cell phones, and all the difficulties about being able to visit a clinic to take medicines such as malaria medicine on a regular basis. Existed there, but not the ability to communicate with your doctor directly. So this is a project called Kernel with the Eames Foundation, the Bill and Melinda Gates Foundation, which looks at very low-cost devices that can be worn, in this case around the neck, and that communicate specifically about certain symptoms and support treatment, essentially, are reminders and a way to communicate with doctors and clinics that are often an hour or 2 hours away on foot. So these are the things that interest me, but I need more people who want to do these things with me. So that's why I want to come visit you.
We are so excited about that, and we're very excited you're here today because there are a room full of people here that would like to exchange ideas with you. I'm very grateful for your interest in healthcare because I think you're going to bring some transformative new things to us. I know that Jill's going to want to ask you about the secret robotic project you told me about
Yes.
in the garden, and so we'll wait till you're ready to reveal that. But I just see the impact that you can have on healthcare is something that we're super excited about. Thank you for coming, and if it's possible for people to reach out to you or follow you along, what's the best way to follow the work that you're doing?
I'm Yves at all the companies I work with. So Yves at fuseproject, which is my team of 80 or so designers. That's actually a few blocks away, but you can reach me at Yves at August or Yves at Jawbone as well.
Thank you very much.
Thank you.
What a special
Appreciate it.
treat. Thank you so much.